Greater Manchester Mental Health NHS Foundation Trust is publicly funded and legally required to produce accounts and to have them independently audited to show that our accounts give a true and fair view of our financial position and that we offer value for money and are equipped to continue trading. We know the accounts can be complicated, so this film will present the key information. Where does our money come from? What did we spend it on? And reassure you that the trust finances are being well managed. In 2020-21, our combined income was £374 million. Most came from our 4 main clinical commissioning groups: Manchester, Bolton, Salford and Trafford, and the rest from Health Education England, the Department of Health and other sources. We also received central funding towards our COVID response. This helped pay for extra staffing and capacity, the vaccination programme, cleaning requirements, infection control and prevention, and to help discharge people into appropriate recovery settings. In 2020-21, our total spend was £370 million, mostly on our greatest asset, our staff, but also on clinical supplies, including drugs and premises management. Our accounts must also represent the current value of our assets, including land and buildings. Each year, we're required to undertake a full independent valuation of the estate. And this year, £1 million of our reported costs were related to a fall in our estate's value. This is a required accounting adjustment called an impairment and doesn't mean we actually spent any cash. It's just important that we report it in the right way. In fact, as we work hard to demonstrate value for money, every pound we receive and spend is important. In 2020-21, your amazing hard work delivered an efficiency improvement of £2 million and a total surplus of £3.8 million. A good surplus is important as it gives us cash to invest in capital assets. A capital asset is something that costs more than £5,000. In the financial year, we were able to invest £2.6 million on our buildings and outdoor spaces, £2.5 million on new devices for remote working, and £1.2 million to connect new services to our IT network and introduced new clinical systems. We also received £8.4 million from successful capital bids to NHS nationally, £3.7 million to design and prepare the new Parkhouse development, £1.8 million to improve buildings and develop the urgent care centre in Bolton, £1.5 million to improve cybersecurity and the IT network, and £1.4 million to develop our patient information clinical system. For 2020-21, KPMG, our external auditors, gave us an unqualified audit opinion, which means that they were happy we had produced accounts in line with all accounting requirements and were very positive about our financial position. The accounts were then sent to Parliament. This year has been challenging for everyone, but we hope that this film has made our finances a little bit easier to understand. But if you do have any questions or queries, then please let us know.